Welcome to the Madness and Grace podcast, where we explore the connection between mental health and faith. I'm Dr. Matthew Stanford, neuroscientist, author, and mental health advocate.
And I'm Dr. Madeline Stiers, therapist and trauma researcher. We're so glad you're joining us today. Each week, we have authentic conversations about personal stories, we share professional insights, and explore the meaningful ways faith can influence mental well-being.
Whether you're seeking comfort, understanding, or simply a new perspective, we're here to journey with you. Thanks for tuning in. Now let's dive into today's conversation. Hello and welcome to Madness and Grace. This is Dr. Matthew Stanford, and with me, as always, is the incomparable Dr. Madeline Stiers. And how are you today, Maddie?
I am good, drinking coffee, getting the morning going. For us, it's morning.
It's the morning here, but it may not be morning where you are. So yes, today we are talking about when a friend or a loved one needs mental health care. This is a topic that we do just about every season, but I think it's one that we really need to always come back to because we get this question all the time, and it really kind of goes two ways. One is I have a friend or a loved one who I believe needs mental health care, but they do not want to go get mental health care, or I have a friend or loved one who needs mental health care and they want to get care, but I don't have a clue how to help them, what to do. And we get that from everyone from pastors to family members to whoever. And so I think it's a great topic to discuss every year, but it just kind of helps everybody be equipped. So Maddie, let's start off with individuals who think someone else needs mental health care, but that person doesn't want to go get mental health care. So what do you think about that when someone comes to you?
Oh, that's a good question. Typically, my brain goes one of two ways. So it's either a loved one, parent, spouse, sibling of someone calling who is very ill. They are either using substances or have started experiencing some pretty extreme symptoms that we see more commonly with serious depression, bipolar disorder, schizophrenia, things along those lines. Or it's a loved one or friend calling and they are unhappy with their relationship. And so they're saying, well, there's something wrong with this other person. They need therapy. I don't like what they're doing, who they are, the choices that they're making in life. But it has nothing to do with the information that I'm getting. It has nothing to do with their actual mental health status. It's really like, I don't like the choices that you're making in life. Therefore, there's something wrong with you. So we need to get you connected to a therapist because there's something wrong with you that needs to be fixed. So that's kind of how I see it is it's always kind of done with love, right? There's this desire for more, either in the relationship or in that person's life. But the reasoning behind it is different. I just like what they're doing, or I'm very concerned about what's happening and what I'm seeing, the changes that I'm seeing in this person. So that's usually how I see it. And both of those are very challenging conversations to have as the provider. And one of the things that we first do, right, is help the loved one have that conversation with help the parent or the spouse have the conversation with the person who's perceived to be struggling. And that's a really challenging conversation too, either way.
Yeah, I think we should kind of go in that direction. So first I would say this, let's say you're the person who is looking at the other person and you're trying to, you think they need mental health care for whatever one of those reasons that you just mentioned. I think you have to ask yourself, first off, how would I feel if somebody came to me and said, I think you need to go see a mental health care provider? I mean, that's, basically most people are going to take that as, you think I'm crazy. And they're not, generally people do not want to see a mental health care provider because of the stigma associated with mental illness and the fear around all of that. So that's a bad thing. I mean, I would put it on I'd kind of put it at the same, if you might think about this, just imagine going up to somebody and say, hey, wow, you really need to go to a dentist.
Yeah.
I don't think anybody's going to go, well, thank you for that. That was such a nice thing. I mean, you might be saying that because you really, maybe you have problems with their teeth and it hurts or whatever, and you want them to do better. But people are going to take that in a very negative way. It's a
Sure.
judging kind of way. So it's the same thing with mental health. And there's a lot of stigma and fear associated. So I think you have to understand that first. So the words that you use and the way you say it are very important. I think a second thing that I would say, and then we can kind of go through what it is you say to people, is let's not be diagnosing people. Okay. If you think somebody might be helped by going to a mental health care provider, we don't have to bring up any diagnosis. We don't have to say any kind of psychology word or psychiatry word. We can just talk about levels of stress or circumstances overwhelming and things like that. The less mental healthy, might we say, it sounds, the more likely someone is to receive it. So now let's imagine, Dr. Stiers, someone has come in and they say that I have a loved one and I really think they need, what is the advice you give them on how to talk to their loved one about that? Should I come up with a scenario?
Well, sure, if you'd like.
I don't know. Let's say that a wife, okay, wants to tell their husband that they think that he is depressed and drinking too much because of a lot of financial problems that they have been having. Is that a decent scenario?
Sure. Yeah. So the reality of how you just outlined that scenario and how the presentation is in our office is very different, because
that's an easy one I gave you right there with a lot of detail. So
very easy. But the reality is people wait until the point of maybe they're seeing the financial impact on their lives and they're talking about having to kind of uproot things and change. People are drinking every day, and we wait until it's kind of more extreme to be able to kind of pinpoint, hey, what's going on and whatnot. So by the time that they're sitting in my office, wife is extremely frustrated and worried, right? But the frustration is what's presenting. So I'm getting a lot of, typically in situations like this, anger and annoyance and frustration and resentment and judgment, like heavy. And so I listen and then you have to remind, like, why are you here? Why is this something that's concerning? Well, because I love him and I want our family to continue, and I want him to be doing well, and he's not doing well. Right. So there's two things to think about: is your wellness as the wife, and then your husband's wellness. And then the third is your wellness as a family. So here's what we can do to help him and talk about having that conversation. Wife needs to think about what she needs to do, which is not place all of this blame and just constantly complain, right? Like maybe she needs a counselor to talk to about all of this. And then how do you help the other person? We help the other person by helping yourself first in a couple's family kind of situation. But how do you even have that conversation? Well, it's the way you approach it. Exactly what you said, Matt. The approach of, you're totally screwing up the family. Look at you. You can't even get out of bed because you're so hungover. Disgusting. Well, that's not going to help anyone. No one's going to feel good. That's very shaming.
You can't be shamed into getting care. It doesn't work.
No.
It doesn't work.
No. So you have to approach it with the truth behind it is love and fear, right? You can share some of your fears, but not in an angry sort of way. Why do we want to talk about, so, hey, husband, what's going on? You seem really stressed. You seem very unwell. Your happiness levels have changed. You used to do this. Now I see you doing this. So pinpointing behaviors that kind of exemplify where their change has occurred. They're likely going to acknowledge that. That's an easy one. Yeah, I used to go golf and now I'm not even talking to my friends. Like, I'm so stressed out. I just come home and drink. Like, that's an easier thing to acknowledge than when it's approached with, like, hey, I've noticed these changes and you don't seem happy, and I love you and I care about you and I want you to be happy for yourself and for our family. Wow, what an easier message to receive than, you're a lazy POS, get up, stop drinking, do more. You're just this drunk. wow, that's going to make someone just totally isolate and shut down. The shame and overwhelming guilt that they're probably already feeling is now being spotlighted. So whether it's alcoholism or depression or any other mental illness, the approach needs to be with love. And like you said, take the psychology words out, take the mental healthy kind of feel out of it. And really, what is it that you want for this person? You want them to be happy. And are they happy? No.
Right.
That's why you're in my office. So especially if someone is so ill that they don't recognize their mental illness challenges, the happiness approach is really a way that I found you can begin that conversation is, you're not happy, because they're oftentimes not. And they'll say, you're right. And well, what do you want to be happy? And you may disagree with that person on what the changes need to be to make them happy, but at least they're engaging in the conversation. They've started down that road. And really this is what, sorry, go ahead.
No, you just, if you got them to agree that they're not happy, you just had a point of agreement, obviously.
Mm-hmm.
And so now you have a point to work off of but like you said, it's not a time to get into an argument or to pull out a list of, here are the things that are going to fix you that I want you to do. That's not important. You just have a point of agreement. A lot of times, I like that idea of you're not happy. A lot of times I'll use, I know you're not where you want to be in life. Yeah. And so, and then they agree with that. And then it's like, okay, well, where do you want to be? Again, I once had a guy say he wanted to be the CEO of a Fortune 500 company. Okay. There was no way this guy was ever going to be the CEO of a Fortune 500 company. But there was a point of agreement. He was not where he wanted to be, and he really wasn't doing well.
So don't shoot it down.
You don't shoot that down. You go, oh, no, that could never happen. Where do you really want to be? No. The next question would be, okay, well, what do we need to do to help you begin to move forward towards that goal? And so, because anything moving towards that goal is going to improve your life. So, but I can have that conversation with somebody that's delusional, and I can have that conversation with somebody who's just feeling down and kind of blue, and never use mental health terms ever. Just like you said with, you don't seem happy. Are you happy? You can do the same thing there. I mean, the most mental health term you use is happy. And so, and that's, another thing I often say is, well, would it be worthwhile us getting connected with somebody that could help you move forward? Again, you don't have to say with a therapist, you just have to say, find somebody that can do that. Maybe you start that out by talking to a friend. Maybe you start that out by talking to a pastor. Maybe you start talking to a counselor. But I think it can be done kind of in a way in which a person doesn't have to feel like you're looking down on them or judging them. You really are compassionate and want to kind of walk forward with them. I think that's important, and, another thing, a lot of times that when you mentioned something very interesting, and that is someone's so ill that they don't realize that they have a mental health problem. Okay. And so now we're talking about someone with a real serious mental health. They might be delusional. They might, and that person does not want to get help because they don't think they need help. How do you help that person begin to get help? Well, again, you can't argue with somebody who isn't rational, and so there's no reason. You can, it's never
it's
ending.
Not fruitful.
But you got to find a point of agreement. You got to find connection. And again, where they are in life, or how their emotions are, those are things that you can both agree on. You might not agree why they're like that, but it allows you to have some point of connection and begin to move them forward. And one of the things, for instance, a lot of times I'll recommend to families is, well, if a person won't go see a mental health care provider, then ask them if they'd be willing to go get a full physical with blood work from a primary care physician, and to tell the primary care physician the things that they've been struggling with. Because at a minimum, you can rule out some physical issues, thyroid, things like that. But also you might have another advocate there in the primary care physician that might be encouraging them to get additional help. But it's always a step forward. And so...
And if it's a quick onset of symptoms, it could be.
Absolutely. You can't make other people do things they don't want to do. You can only control your own behavior. And how you react and how you engage them is really going to drive a lot of this. And so, I always I always tell families this study that came out long ago, people with serious mental illness that were receiving no treatment, their family members, who basically were their caretakers at some level, were put into a psychoeducational support group where they learned about the illness, they learned about how to interact with people with the illness, and they were given support for their own struggles that they were having as a result of the illness. And what they found were that the individuals that had the serious mental illness that were not receiving treatment improved, even though they were receiving no treatment, just because of the way their families were interacting with them and dealing with their problems. So I'm not saying don't get them help. What I'm saying is you can help them by just helping yourself engage in a better way.
Yeah, I think it's extremely challenging for families, particularly parents, because the individual who's struggling, who they're calling about or showing up, they're usually an adult, right? If it's a child, there's a bit more, when I say child, I mean 18 and younger, right? There's a bit more, parental influence that you have within the system. You just pick them up, take them. Once they're 18 and older, like it's really challenging. One, the medical system will kind of shut you out because of HIPAA laws and regulations. And two, they've been functioning as an independent adult and, mom and dad don't know anything, right? Like, stop telling me what to do. And then you see the dynamic of parent-child come back into play, and the parent wants to just say, do exactly as I say. And then there's pushback. And so the parents become, even though they're trying to help, can become very frustrated with the conversation because it's back to, if you would just listen to me, if you would just do this, and the child's going to completely reject that notion. So that's why I tell people, bring it back to love and happiness, right? I love you. I want to help you. I want to see you succeed and be happy. And I notice that you're not happy right now. Get back to a point of agreement. So then the idea of what the next step looks like can be taken. Whether you totally think the next step is the best next step, you're making movement, you're making progress. It's a very challenging conversation to have that parents constantly, and loved ones, but primarily parents, fall back into this, like, just do what I say, do as I say. And so getting into, we run, families transformed groups here at the center. And oftentimes we tell family members, hey, go to this group. Like, it's super helpful. Just the psychoeducational aspect of it is great, but the peer support, and that you have other family members of, your peers that are going through similar experiences, kind of validating what it is and helping you relate to how all of this is connected and you're not alone in this, can be very, very rewarding. And you see families helping set boundaries a little bit more effectively and having more effective conversations with someone who needs pretty significant support. It's and it's a great resource. So if you're interested in those groups, we'll put some of the information in the show notes here, and then you can actually become trained to facilitate one of those. And we'll put that information for Gateway to Hope You in the show notes also.
Yeah, it's hard to watch your friends and loved ones suffer. It's hard to watch anyone suffer. So the other thing I think is a lot of times you want kind of this quick fix, like I'm going to fix them or I'm going to get a quick fix. One of the things you have to understand, mental health problems are not something that are quick fixed. It takes time. So you got to kind of take that off the table. I know it's frustrating, but no one wants to go see a mental health care provider. So that's just a fact. I do think that, what you have to do is you have to step back and not get, I know I just said this earlier, not get into diagnosing. You are not, the reason that you are trying to get them to get some support or some assistance is not because they have depression, let's say. The reason you're doing, because you don't have the ability to diagnose that. The reason you want them to get help or support is because you notice some problem behaviors, some problem emotions, you see some things that fall within a mental health realm, and you would like them to get some assistance with that because you believe that those are a struggle that they're having. So you really got to get away from the diagnostic kind of a thing, because again, you're going to taint the waters in a lot of different ways by throwing those kind of things out. And so you really just want to get them in front of someone. I think, again, one of the things I've said is this idea of being on a continuum. You can really struggle with overwhelming emotions and circumstances and not have a mental illness, but still be helped by support and even counseling. So getting them to sit down with someone. And I think this is where a faith community is a huge benefit. So if this is a person of faith, getting them to sit down with a pastor, getting them to sit down with a lay counselor, or a mental health coach at a church and just talk about these things is a lot of times less kind of aversive to a person than sitting down with a mental health care provider.
Yeah.
I know that, I've told families where the person was a person of faith and they were really trying to look at more spiritual, the person was trying to look at more spiritual kind of interventions to deal with their problems. Ask the person if they'd be willing to just come meet with me and talk about their faith. We don't have to talk about anything else, and so that kind of helps, it's not unlike, it's not unlike the going and getting the physical, it's something everybody does. And so it doesn't seem like something that people would be afraid of doing. And so giving them some alternatives on that, I think, let's just say the person just completely refuses to go and they're struggling. Well, I think you have to step back. You have to not become naggy. That's not going to help with the relationship. The relationship you have with them is going to be the best option for them getting some help. Let's just say they need help. The best option for them getting help. So you're just a pointer. You're going to point them to care. But you need to step back and you need to say, how can I help them in their daily struggles with this now? What can I do to be helpful? So maybe you go and talk to a pastor or a lay counselor or even a mental health care provider about how you might help them. I remember a mother that I met with many years ago whose son, and this is a very seriously ill individual, he had schizophrenia, which he did not recognize that he actually had schizophrenia. He was willing to recognize he had depression, but because his life really kind of fallen apart, but he wouldn't get any treatment. So she actually came and started meeting with me. And what we did is she would come in and tell me about the symptoms and the problems he was struggling with. And we went through the regular cognitive behavior therapy kind of curriculum that we have. And I would go through and teach her the things that I would have taught him or we would have talked about. And then she began to instill those in her interactions with him and, kind of having a structured routine around the house. And after a year of doing that, he was 33 years old at the time. After a year of doing that, she came in one session and she said to me, I have a better relationship with my son today than I have ever had in my entire life. And at that point, he was only willing to receive treatment for depression, not for his schizophrenia, but their relationship had completely changed. He was improving because of that relationship. He was getting some minimal treatment for his depression. But most people would have thought, well, that's not what we need. Well, that's what he was willing to do. And so I think those are the kind of things that you need to think about. How can you support them and care for them, not fix them, support and care for them as they go through these difficult times?
And that's a really great way of outlining that. And it's also true for a friend or a loved one who is kind of the opposite of what we've been talking about. Maybe they're overly needy and they are oversharing and really kind of looking to you to be their therapist. So how do you have that conversation? What do you do and how do you support someone without becoming their therapist, right? So setting boundaries. And so part of that might be doing a family support group or kind of talking with someone, like you said, working through like, how do you support someone, especially if you're somewhat their caregiver, but also establish boundaries and walk through that, because you do have the flip side of that. Now, oftentimes people don't think of it as challenging because that person is wanting care. They want support. They want to create a system of care and support, but it can become very draining on those around that.
You can find yourself drowning in their problems.
Yeah, it's really challenging. And So that's where taking care of yourself really is instrumental in this, and understanding what boundaries are and how you implement them effectively, and what people's reactions and responses are sometimes, oftentimes, to when we establish new boundaries. I found that boundaries is a great conversation to have with people, because we think that we know what they are. We think we know what our boundaries are. We think we just know what boundaries are in general. And when you really ask someone to explain it, it's they have this idea of like a fence, like a boundary. It stops people from like hurting me. And you're like, yes. And how does that show up in your life? How do you implement that? What does that look like? And they have no ideas. People are just out here kind of
you step in to support somebody, and they just grab onto you like a drowning man, and that, that's the whole point. Like, and that's really the great analogy, is that, when someone is drowning, they always tell you, you really have to be careful, because they'll pull you under also. And so, you find yourself from like just having a little conversation to the person about, let's see if we can find someone that can walk along with you, to like, you have 50 texts a day. And so it's a real problem. You got to be real careful. I think you got to step back, and you got to remember, you cannot fix them. That's not your role, and it's not something you can even do if you wanted to. You can be part of a support system for them, but it has to be reasonable and healthy for both of you. And that is not every time they have a problem, every time they have to make a decision, every time anything goes wrong, they have to talk to you. That's not sustainable. It's not healthy for them, and it's not healthy for you. And so what happens when that relationship is destroyed by a lack of boundaries? And now they're worse off than they were to begin with. And so, I think you have to tell them, I think you have to be very humble. You have to say, you know what, I'm here to support you, but I don't have the skill set to be able to move you forward the way. So that's why we need to get somebody else involved. And then you do have to set up boundaries, as you said. And that's a whole nother episode on setting up boundaries. What a great idea. A whole episode on setting up boundaries, healthy boundaries.
That's true. Healthy boundaries.
Healthy boundaries make a relationship better. They're not to punish people. They're to make a relationship better.
But if you're someone who's listening to this episode because the title caught your eye, and you've got a family member, a loved one who has in the past or is now struggling, and you know that you're needing some support around it, reach out. You're not alone in your discomfort around wanting to have the conversation, or your lack of knowledge around what to say. Like, ask someone for some support, ask for help. Hopefully this episode today has helped you get a little bit more of an understanding on how to approach the conversation. But you're not alone. This is a conversation that we see all the time with family and loved ones. They struggle on how to address their mental health care of their family or friends. So check out some of our other episodes. We've got some great ones coming up. Hopefully you have enjoyed today's episode, and we will see you next time on Madness and Grace. Thanks for joining our conversation on this episode of the Madness and Grace podcast. If you found value in our discussion today, we'd love it if you'd subscribe wherever you listen to podcasts so you never miss an episode.
And if you enjoyed what you heard, please consider leaving us a rating and review. It helps others find these important conversations.
Sharing this podcast with friends and family members is also a wonderful way to extend hope to those who might be struggling with mental health concerns.
We'll be back next time with another candid conversation about madness and grace. See you then.